What is this musculoskeletal pain all about?
Musculoskeletal is the word itself describes muscles and skeletal.
Why is it this kind of pain in today's life becomes so rampant?
When we develop, it comes with own consequences as well.
Cost.
We are sitting with the computers, we are sitting in the office, we are sitting in the AC rooms. The physical activity has compromised significantly.
Now, every developer sits for more than 8 hours in a day.
The corporate health and wellness is meant for targeting all the employees.
Hello, everyone. My name is Sujay. I bring to you today a subject which is very important today, in today's life at least, wherein every third guy in India is suffering from some kind of an occupational pain or any kind of joint pains which is happening frequently with people. So today we have an expert who is going to tell us more about this concept called as the musculoskeletal pain or the problems. Now, the guest we have today is an authority on this subject and also a gold medalist in this subject who has been treating numerous patients and getting rid of the pain they come to him with. So let me introduce our guest. Is Dr. Arun, who is a specialist in musculoskeletal physiotherapy. And we are now at a center called Prehab. So, Dr. Arun, honor to have you here.
Thank you so much.
So, as I introduced to you guys, so we'll be talking about various aspects of pain, joint pains, and so many other occupational pains, what I described. So, to start with, Dr. Arun, I want to know, what is this musculoskeletal pain all about?
Absolutely. First, thank you so much. Thank you for
It's a pleasure.
being here, and it's my great pleasure to be here. Musculoskeletal is the word itself describes musculoskeletal, muscles and skeletal.
Okay.
Muscles, we all know. Skeletal means bone, joint.
Okay.
The bone, if it is anything related to fracture or injury, and joint, which include cartilage, ligaments, all that issues. So
Okay.
any issues to the muscle, ligament, joint, bone, what public has it, either an orthopedic doctor see from a structural point of view, if
Okay.
there is a breaking of the bone, tear of a ligament, rupture of a muscle, a surgeon look after the repairing it, and we get the function out of it. So we ensure the muscle, joint, bone, ligament function properly so that person walks well.
Okay. So, why is it this kind of pain in today's life becomes so rampant? Which means that every guy whom I speak to comes up and says, I have a back pain, I have a neck pain, or some kind of joint pains. Why is that today it is so rampant compared to our earlier days?
Absolutely. India is progressing so fast, and we are developing our nation in a super speed way. And when we develop, it comes with own consequences as
Cost, yeah.
And earlier, let's say 2 generations earlier, where the job was farming or going to a labor, so physical work.
So you mean it was more of physical?
It was a lot of physical work.
Okay.
And now we are more of static work because of the development. Instead of being in the farm, we are in the computers.
Okay. Okay.
So we are sitting with the computers, we are sitting in the office, we are sitting in the AC rooms, and the physical activity has compromised significantly. The body's abilities has gone down significantly, and that's where we are prone to problems. So that's why India is today 140 crore populations. Almost every single person suffer from a back pain in their lifetime once.
Okay. All right. Now, this question is for the techies. Today, the largest workforce in India is technology. Now, every developer sits for more than 8 hours in a day. Now, most of the people whom we talk to have some or the other pain in their body where it is attributed to their occupation. So, how would you actually, address this issue?
So every occupation got its work-related musculoskeletal disorders,
Okay.
including physiotherapist has his own possibility that we can develop our.
Oh, is it? Even you can get paid.
Absolutely.
Of course.
A surgeon is prone for occupational related disorders.
Okay.
So similarly, every sport, techie as well as the doctors, surgeons, physicians, we all are prone for. But especially technology people, I would say, in fact, now every housewife we use 6-hour phone.
Yes.
So even they are techie now.
They are techie.
And the schools are being more technology oriented. There are a
Yeah.
lot of computer classes, computer use, which is a great thing. But at the same time, it comes with its own cost. And the reason is physical. So
Okay.
the posture where they sit with, of course, sometimes when there is a stressful work, oh, I have to finish.
Yeah.
I adopt a faulty posture. And that faulty posture makes me vulnerable
Okay.
to develop some aches and pains.
Okay.
And that vulnerability makes the injury incidences very high.
Okay.
And that's where techies, mobile users, phone users are on high prone.
So in that case, I am actually going for an occupation and I'm developing a pain because of that. And I eventually end up paying for relieving that pain, right?
Absolutely.
So how can, experts like you play an important role in, advising them on a whole, or even redesigning or structuring the interiors of an office where these people sit for 8+ hours, so that you can at least bring down that potentially that they need not be these patients who will get these kind of pain. Is there have you been doing something like this wherein you engage yourself in these kind of activity too?
Absolutely, yes. I am actively in this.
Okay.
Super actively in this. Why? Because this cost a huge. For example, let's say we are a team of 10 people. Out of 10, because of the continuous work, 2 people got a simple neck pain.
Okay.
Because of the neck pain, one day somehow he managed to work.
Okay.
With the poor quality of work. 2 days, 3 days later, his pain is significantly bad. What we will do? Hey, boss, I am unable to come. So the 2 people took a day off. It means 20% of your staff is on holiday today.
Yes.
So your productivity of your team compromise.
It's coming down.
Is gone down. Now these 2 people, of course, they go to a doctor, a physio, or any institution for solution, and nobody will treat it free of cost.
Yeah.
And that's where the cost on his pocket, and if company is taking care of the cost on the company's things has increased.
Is increasing.
With this pain, with that holiday,
Yeah.
he won't be able to utilize with the family also.
Okay.
The personal life also compromises.
Okay.
Now, if that become a chronic issue, and over years, he won't be able to provide a quality care, productivity won't increase, the job satisfaction get reduced.
So in that case, is it a possibility that you can advise that if a developer is sitting for over 8 hours in a chair, what is he supposed to do? Should he take intermittent intervals, or how is that?
So in this kind of scenarios, there are 2 possibilities. Either you create a structure which makes him healthy.
Okay.
Which is passive things, which is an external thing. Or second is you create inside your body to make sure that you are able to do in whichever atmosphere you are. So that's called external, that's called internal. So external is all ergonomics. Ergonomics can be optimized at certain level. The position of the computer, position of the table, sitting table, standing table. But when I say actively I'm involved, I focus on improving the body's capability to work in whatever atmosphere they are working in.
Okay. Okay.
So
That's interesting.
So improve your muscles, posture, joint, mobility, functionality, stability.
Okay.
So that if you have to carry a 100 kg bag next day to your home, you should be able to.
Okay.
So improve your abilities. Don't get yourself comfortable surroundings.
Okay.
We can make it comfortable with ergonomics, with a good mattress, good seat, good height. That can be done. All are controllable. But I would want to focus only internal component, improve the body's capability. And when I say actively, there is something called the corporate health and wellness.
Okay.
The corporate health and wellness is meant for targeting all the employees. Once in a year, they should go for a physical health screening.
Okay.
So when you say what we can do something called physical health screening.
Screening. Okay.
Physical health screening improves, assess your posture, your movement, your stability, and we get to know that what is this employee's physical performance is. And based on that, we can actually create a structure
Okay.
to improve his ability and reduce his vulnerability.
Okay.
If that can happen every year once for the employees, we can actually reduce significant amount of
So
disorders.
there can be a preventive mechanism.
Absolutely.
Okay.
Preventive, and also based on the findings, we can solve it.
Okay. See, they say that sitting is the new smoking, right? So how do you avoid that? Because as you rightly said, today's occupation is moved towards more of sitting down on the system. It's more of the brain work that take the stress, things like that, rather than moving around and getting things done. So how would you, what would you like to advise the person sitting in a chair for over 8 hours and working?
Absolutely. More than 60 minutes of sitting is equal to smoking a cigarette.
Okay.
This is a philosophical motivation.
Okay.
It's a philosophical motivation. We are motivating people who are sitting.
Okay.
But doesn't mean that we have to get out of the chair every time and do walk and do all that. It's not possible. Your 8 hour of working time. Every employee, every business owner has to work that time. But if you, before and after 8 hour hours, out of 24 hours, remaining 16 hours, if you can adopt some physical activity, this the encouragement statement can be changed. So, of course, you move, get out of the chair, move, but it is a motivational quote.
Okay. Okay.
Ultimately, I would suggest before or after, spare time in a physical activity.